The condition is common in humans, but our canine companions can get them too. On this episode of the Paw Report, we're joined by Greg Reilly of the Honey Creek Animal Hospital in Terre Haute, Indiana, to talk about cataracts. Dogs of all ages and breeds can develop this eye problem, and coming up, we'll talk about treatments. So stay with us. Production of the Paw Report is brought to you by
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
OCA Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. OCA Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at ocavetclinic.com.
And thanks for joining us for this episode of the Paw Report. We are joined by Greg Reilly of the Honey Creek Animal Hospital over in Terre Haute, Indiana, and his good buddy Moppet. Thank you for joining us and making the journey over to Charleston. Pleasure. I have a little story about Greg. Now, Greg and I met probably 20 plus years ago.
True.
When I was a morning anchor at a commercial station in Indiana, and I coerced him to come on the air, and he was talking about pet adoptions and should I tell the viewers that you nearly got sick the first time you were,
may as well.
you were on TV? Well, he did a fantastic job, and here we are. Here we are again today.
Here we are again.
Same chairs, different station, different backdrop, but we appreciate you joining us and bringing Moppet here, who's not a stranger to TV either.
Not a stranger on TV. She goes on WTHI in the morning. She's my dog prop. So, and you know, really quickly, that was what, 2001, I think we were doing this together.
A long time ago.
So someone still looks really good. Someone still looks kind of hagged out. That'd be me. So you look great.
Well, thank you. And thanks for joining us for this episode.
Thank you for having me.
We're going to talk about cataracts in canines and also a little bit about glaucoma. So we'll start with, what is a cataract?
A cataract is formed within the lens of the eye, and over a period of time, could be rather quickly, could be a long period of time, that lens that is filled up with water will build up protein. And the protein within the lens of the eye will start sticking together and eventually will become like a cloud, almost like a white cloud. And that basically is the form of cataracts.
What is not a cataract? Because sometimes it can be confusing. You know, if there's an eye, an eye issue, and immediately if you see it's milky or something, it may not necessarily be a cataract.
Right, there's something that's called a nuclear sclerosis, and that's just basically an age problem within a dog. So a lot of people will see that, and this lens will eventually have changes due to age, and it'll kind of have, like I say, a bluish gray look about that. That's not truly cataract, and the dog can still see perfectly fine.
Mm-hmm. And you kind of talked about it when you defined what a cataract is, but I guess, if I'm a pet owner, I want to know and I've had a dog that's had cataracts, why did my dog develop it?
Well, there's three ways that really a dog can come down with cataracts, and one obviously is age. Another one is going to be disease, like say diabetes. If your dog does come down with diabetes, or if your cat has diabetes, there's a very good high chance of them coming down with cataracts. Let's say a cat that has leukemia or feline AIDS. That's another reason why they may come down with cataracts. The third one would be trauma, where, unfortunately, your dog gets outside and there's an accident, gets hit by a car or something like that. That can also lead to cataracts also.
I had a yellow lab that had developed cataracts. Mm-hmm. And it was, and maybe it's just something that I didn't notice over time, but my yellow lab was very connected to me, and really suffered from separation anxiety if she wasn't around me. And I went on a trip, and she was taken to a kennel, and it seemed like after that experience, it spawned. Her eyes started changing. Can stress, anxiety, depression, so to speak, spawn cataracts in animals, or is that just something that maybe I just coincidentally happen?
Right. I would say that would be very hard to define. I had a very good friend that has a Australian Shepherd by the name of Ruby. And my friend Colleen was having some personal problems where she was just day boarding Ruby with us. And literally within 24 hours, this cataract just built up. So hypothetically, it is a probability that, maybe stress could bring it on. But basically, the overall symptom of the protein that's building up within the lens, that's still non-negotiable. I mean, that's still going to happen, whether or not it's brought on by stress or not. It could happen. I can't rule that out.
So I bring in my pet to your animal hospital. How do you go through the diagnostic testing, to see for sure if a dog has the problem?
Usually the owner will say something along the lines of that. I don't really think, let's say Moppet right here is doing too well. She's bumping into things. She's having a hard time getting around. She seems to be, say, hesitant walking down the hallway or down some stairs. And you can kind of take a look at the eye. So basically, I've got a couple of props here for us.
You can let Moppet down.
We're going to let Moppet down?
She can run around the set while we
All
talk
right.
about this.
So we have an eye right here. I'm going to let you hold that, okay? And if we take a look at the eye, we have the cornea, which is going to be this top part right here. You're going to have the sclera, which is your white part of the eye. You're going to have your iris, and then your pupil. Okay, and your pupil basically forms more or less as, like, say, a camera for the eye, and that's going to help focusing the images that you're seeing that gets projected to the back of your eye. So when we put the cornea back on, what will happen is that you'll have a clear lens that just goes right behind the pupil, just like that. And over a period of time, there are three things that forms of cataract. One is called an incipient cataract, which you barely even notice. And that'll be something along like this, okay? And you'll start seeing the protein, unfortunately, will start building up right around the edges of the lens and maybe a little bit towards the middle, if we can get a shot of that, okay? You'll have an immature cataract where you have a little bit more forming, and then eventually you'll have a mature cataract where you'll have the classic complete white lens. There's not a whole lot of light that comes through the lens to the back. The dog's vision is kind of cloudy and really fuzzy and has a really hard time walking around.
And it's almost, it looks like a milky cloud.
Indeed, absolutely.
Now, how are they treated? I come in, I bring my dog, and maybe I have various stages.
Right.
Are there different types of treatment that can be done to assist a pet owner?
There's really only, as far as I know, really only one type of treatment, and that's going to be basically surgery. And what you would need to do is, go to your veterinarian. Your veterinarian would confirm indeed that your dog has cataracts. They would call a veterinary ophthalmologist or a specialist, or sometimes a university, like let's say University of Illinois or Purdue, and they'll schedule a surgery. And what they'll do with the surgery is that they will go in and they will remove the lens that is clouded, okay? And then they'll put in a replacement lens. And this replacement lens could be either plastic or it could be acrylic. But the nice thing about it, over time, and with proper treatment with eye drops and medication, the vision will be restored and you'll have a completely brand new dog.
Now, do you have to wait until the severity of the cataract before surgery is done?
Not necessarily.
You don't have to wait till it's actually the
mature cataract? I don't
mature
believe
cataract.
so. No.
How well will my dog see after a surgery is performed?
With the proper medication and time and rest, vision should be pretty much restored almost completely.
And how long will that regime of medicine and treatment have to go on after the initial surgery?
Usually about a month, sometimes a month and a half or so.
And is cataract surgery, is it an expensive
Can be.
an expensive feat for somebody?
It can be, and that's
In
basically
the thousands?
easily, and that's just due to the equipment that the veterinarian has to spend to buy, the amount of training that the veterinarian has to go through. Let's say you go to vet school, okay, and you graduate. You don't get to learn how to, remove a cataract lens or anything like that. That's something completely different where you're going to have to specialize in that one area only. So that's even more schooling. And as a result, obviously, more cost on you, the student.
Is it common in both eyes? If one eye has a cataract, should I expect that my dog's other eye is going to have the same problem?
Not necessarily. Yeah, that's a very good question. Not necessarily. I mean, there'll be one time where one dog, one eye will have a cataract problem, say a mature cataract, and the other eye will have, like I say, an incipient cataract where it's, not really forming. But on that note, if the dog does have, say, diabetes, chances are of both eyes coming down with cataracts is pretty high.
What if I elect not to have the surgery?
Okay. Well, basically, I mean, that's, certainly an owner's prerogative. Usually the dog still will have a good life. Now, one of the problems that it can happen is that this lens within the eye can become detached and will float around, and that's called a luxation. And sometimes when it's floating around, it can cause some severe pain within the eye itself. And that's when you probably want to start thinking about maybe doing surgery and removing the lens.
Again, take me through the surgery. So they're actually, and you can use this as a description. You did it, you discussed it ever so briefly, but is it, how long is it, and then what exactly do they do?
I'd imagine there's probably an incision that's made along with the sclera. I think we're going to have some video hopefully later on that will show how the process is actually done. The lens itself will be removed out of the orb of the eye, and then a new lens, a replacement lens, will be replaced with that. And it'll be an artificial lens, obviously. It'll be either, like I said, plastic or acrylic. The acrylic ones seem to be doing pretty well.
What are some of the risks? You mentioned some that's risks if you don't have it done, but are there risks if I decide to have it done and everything seems to be going well?
Certainly there's a lot of complications. The first and foremost is, if your dog is healthy enough to have the surgery performed. If the dog is really old, like let's say we have, your lab and it's 12 years old, you may want to start thinking about, is this a necessary procedure done on your dog, given that, she's 12 years old? What are the chances of something happening during surgery? So some of those things should be taken into consideration before surgery is performed.
Do you have any memorable cases that have come through your office? Any dogs or stories maybe that you could share with our viewers to maybe if they're in the process of thinking about this, maybe some words of encouragement that you could give them?
Well, I can certainly use a client of mine, a friend of mine. Her name is Colleen Chestnut. She had a dog named Ruby who came down with cataracts literally within 24 hours. And Ruby is literally Colleen's soulmate, so to speak. I mean, those two are inseparable. They went over to IndyVet over in Indianapolis where Dr. Klein performed the surgery. She did a fantastic job. You could really see the differences before and afterwards, and Ruby is completely a new dog. I mean, she's just fabulous.
Success story, and that's what
Great
we like
success
to hear.
story, yeah, definitely.
We've talked a lot about cataracts, but I think it's also important that we talk about glaucoma. What is the difference between cataracts and glaucoma?
Glaucoma is basically where fluid is built up within the orb of the eye, and that can also be caused by cataracts. So the way you can measure, say, glaucoma is fluid is built up, and that's called a intraocular pressure, or IOP. And the way you measure it is this wonderful little device called a tonometer, and we have this little gadget, wonderful toy right here, and that way you can measure the pressure within the eye. The way the pressure in the eye is built up is there is a filtration narrowing, or a filtration angle within the cornea and your iris. And it's really kind of hard to explain, maybe a little bit complicated on how that works, but what the fluid does is that it keeps the eye, inside of the eye, nice and sterile. It keeps it clean, it keeps it moist and functional. And what happens is when that angle, this little duct valve, we'll just say, becomes clogged or plugged up, that's where the fluid starts building up in the eye.
And this happens over time, or is it something, I mean, is it very similar to a cataract where it could come on, I wouldn't say rather instantaneous, but it could come on rather quickly?
It can come on rather quickly depending on, the problem of that filtration angle. So, the other thing that can possibly happen is that if your dog does have, like, let's say, cataracts, and I had talked about how the lens could possibly detach itself and could be floating around. If the lens were to come up across that duct, that could also be plugging up the duct, and that also will build up pressure within the orb of the eye.
So how is this device used on the eye? So if I bring Moppet into your office and you need to test that, how exactly is it utilized?
That's a really good question, and to be honest with you, I really don't know.
That is a device, yeah.
This would be from a specialist that they would able to determine, whether or not the pressure of the eye is normal or she's gaining pressure within her eye.
How does, specifically, how does glaucoma affect the eye? Is it a vision, visually? So your pet would have a hard time seeing? Very similar to a cataract. How do I know that my pet has glaucoma?
Really, the big probably thing that you would start noticing is that the eye itself will start changing color. The sclera, or the white part of the eye, will become reddened. The actual cornea itself and the eye orb will start becoming enlarged. It's a very painful condition for the dog or cat.
And treatment, I mean, is it surgery again, or is there medicine, or, I mean, when you're talking expense for people, I mean, that's, unfortunately, we all love our pets. A lot of people treat them as our children. But sometimes when you consult somebody about this, are there more than one options?
There's really two options, and there possibly may be more. One is obviously a surgical option where they can go in and try to alleviate some of the fluid that's being built up within the eye. Probably the easiest and the less expensive option would be, say, something called enucleation, where that's just the eye is just completely removed and the optic nerve is sutured together, more or less. The eye flap would be sutured down onto the dog, and then the normal eye would be fine, more or less.
Let me ask you this. What about breeds? When we're talking about cataracts and glaucoma, what type of dog is Moppet here? You see fat, or, flat-faced animals. There's large breeds. There's small breeds. Is it particular, and if it is particular to certain breeds, why?
Well, I should probably tell everyone what Moppet exactly is, other than she almost looks like a
mop.
Yeah, she does look like a puppet, really, on Sesame Street. But she's a Brussels Griffon, and as far as I know, I don't think she's predisposed to having cataracts or glaucoma, although I may be wrong on that. But some of the things, like, say, for cataracts, we would say Boston Terriers for one. Poodles would be a good one. Let me see here. Bichon Frise, miniature Schnauzers would be others. But realistically, pretty much almost any breed of dog can come down. But those breeds usually are more predisposed than others.
And when you say predisposed, what do you mean? Because most of those breeds are small breeds.
Right. Predisposed means that you have a higher chance of that dog coming down with cataracts as opposed to, say, a mutt, more or less.
And it's just along the lines, the breeding lines?
Correct, yeah, hereditary, correct.
And do they develop them at a certain age, or I know you mentioned there could be some disease involved, but let's say that there's not disease involved. Is it something that's age related just to that particular type of dog?
Correct. They can have it when they're actually born, and it can resolve itself over a period of time, but normally it's when your dog becomes geriatric or older. That's when the protein within the lens starts to build up a little bit more quicker.
Consult me as somebody that's coming into your office. I'm just torn on what to do. Maybe my dog is middle-aged, maybe it's older. I'm not really sure what the best advice would be.
Right.
And our animals can't talk to us.
Right.
So one thing that's scary is you don't really know what they can see and what they can't see.
Right.
What would you tell me or viewers out there that are just, I wouldn't say panic mode, but they're
Concerned.
Very concerned.
Sure. I think probably the best thing that they should probably take in consideration is their lifestyle. If the dog seems to be, or cat seems to be relatively okay and happy, whether or not you should question pursuing, say, surgery, because it is going to be expensive for cataracts. If the dog seems to get around pretty good, and most dogs usually will get around, in a house that they're familiar with pretty well, most people usually will forgo the surgery and just let the dog live out its, normal life. If they do want to pursue surgery, that's when we would refer them to an ophthalmologist, a veterinary ophthalmologist, a specialist, and they can, whether or not advise whether or not the dog would be a good candidate for that surgery.
Do you also see, we've spent all of our time really, and we have just a few minutes left here. Do you see very many cases in cats, or is that a totally different ballgame? Can they develop both cataracts and glaucoma as well? Is it specific to certain breeds of cats?
Right. They can, but the big thing with cats is that if a cat is perfectly healthy, they can live a normal life without developing cataracts or glaucoma. It's usually a predisposed, a predisposed disease, but like let's say if they have diabetes, they would be more prone to coming down with it. Or if they have, like, say, feline AIDS or feline leukemia, there's usually an underlying disease that will cause the cataracts. If they're perfectly healthy, like some of my cats that I've had, they usually don't come down with cataracts.
No, very interesting. Well, Moppet, Greg, thank you so much for joining us for this episode of the Paw Report. Very enlightening. Having a dog that was exposed to cataracts, it's scary because you just want so desperately for them to look at you and stare at you and stare into your eyes, but a lot of times they're off wondering because their vision is blurred. So some good advice, some good information, and obviously hopefully we help some pet owners out there make an important decision in their pet's life. Thanks for joining us.
Thank you.
And thank you for spending some time with us here on the Paw Report. We'll see you next time. Did you know full episodes of the Paw Report are on YouTube? They can be accessed at youtube.com/WEIUTV. Then just go to the Paw Report playlist and select the episode you want to see. More information about the show is also available 24/7 on our website at WEIU.net under the Television tab. Many times throughout the year, we're reminded to honor and thank our fallen heroes and veterans who have served to fight for our freedom. But one dog is raising a voice to honor the canines who served along the men and women of our country. In this Paw Report Extra, Wendy Land has the story of one dog's tribute to them.
They're soldiers too. They fight just as much as we do.
Definitely unsung heroes, that's for sure.
But not unsung anymore. Belle is your ordinary Great Dane. She loves tug-of-war, long walks, romping with her brother and sister, and giving hugs, all 125 pounds of her. But what makes her extraordinary is her love for this country and those who have fought for it.
While I sing for our fallen heroes, she sings along for all our canine fallen heroes.
When Belle wears her American flag bandana, she knows she has a job to do.
And she simply goes into that job. It's her duty, I think she feels.
And she may only be 2 years old, but she's wise beyond her years.
She was a puppy and just would follow me to my little studio at home. And instead of jumping up and down and making a fuss, she started humming along. And then before we knew it, we had her singing along with me every time I sang.
Now Mo sings with Belle to honor fallen heroes, human and canine.
I also recognized when she started just singing along with me that we couldn't forget our canine warriors. They have been there alongside, and they've often been lost with their trainers. She came with a gift, as a gift, and with a gift, I believe. And the way that she has helped with us being kind of a shiny spot in all the sadness, because she touches everybody's heart.
Production of the Paw Report is brought to you by
Okaw Vet Clinic in Tuscola and Dr. Sally Foote remind you to properly take care of your pets and are happy to help support the Paw Report on WEIU. Okaw Vet Clinic located at 140 West Sale Street in downtown Tuscola. More information available at okawvetclinic.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.